Since 1990, we have spent millions of euros and tens of thousands of research hours to find scientific answers to life's most important and challenging questions. What makes us happy? What makes us healthy? How can we heal from physical and mental disease? How can we heal emotionally and sexually so we can be happy in our relationships? How can we develop our talents and be of value to the world? We have interviewed more than 15,000 people and asked more than 4,000 different questions. After 20 years of intensive research, we are beginning to find the answers we have been looking for so long. We have already presented these answers in 250 research papers and about 30 books. Now we bring it all to you. The need for evidence-based, non-drug medicine. Evidence-based medicine, EBM, is defined as the integration of the best research evidence with clinical expertise and patient values. So we have research evidence, clinical expertise, and patient values. There's a certain beauty of this if you think about it. The patient comes and for instance, many patients these days do not want drugs because drugs are always harmful. So if there is a way without drugs and surgery and the use of force and damage to mind and body, of course most patients will find this a good idea. Then we have the research. It comes in a hierarchy of quality. The big meta-analysis like the Cochrane reviews are a much more valid source of information than, for instance, information that comes from a pharmaceutical company that wants to sell a drug. We know, especially from the work made by the Danish professor and leader of the Nordic Cochrane Institute, Peter Gøtzsche. He wrote a memorable book called Deadly Medicine last year, which I can recommend. But it's very important, of course, that you take the best scientific evidence. And for some diseases, the best evidence really points to a drug. For instance, syphilis or gonorrhea or the Lyme's disease. Obviously you need a drug for these disorders, these diseases. As I read the evidence, be no doubt about that. And if you have a mental disorder like schizophrenia, psychosis, depression, anxiety, compulsive, obsessive, whatever disorder, eating disorder, then the drugs are, according to the Cochrane reviews, definitely not the cure of choice. You need psychotherapy, maybe even holistic therapy, alternative therapy that combines talk therapy and touch therapy. Very often sexuality can be helpful, but drugs are definitely not the cure of choice. But then again, it depends on the patient's values. Because if the patient is insisting on a drug, then it might be correct to give a drug in spite of the evidence showing that only 1 in 10 or 20 would be helped by a drug and 1 in 2 or 3, maybe 1 in 1 of the patients would be harmed by adverse effects. But you see, it's also about what the patient knows. So the information of the patient is extremely important also. So the patient has a true choice. For instance, if you do not know that 1 in 20 is helped by a drug and 19 in 20 is helped by psychotherapy, and 1 in 2 is harmed by the drugs and 1 in 64,000 is harmed by psychotherapy. If you do not know these things, then you cannot really choose objectively and fairly. So of course information of the patient is crucial. in this kind of medicine. The third thing here is the doctors or therapists' clinical experience. This is a tricky one because it depends very much on the tradition in which the doctor or therapist is trained. For instance, if you are trained at the Danish university these days, most likely if you're a physician, you will just give a drug because the 6.5 years of training has like 10 hours of psychology or something like this, and this is very shallow, and obviously there's no importance given to that. So you can say the doctors are totally brainwashed to push drugs, and of course this is not good for the patient because according to medical science, drugs can only help a little fraction of the diseases we know in a good way. So obviously this also goes back to the training of the doctor therapist, and you also need to understand what a doctor is these days and what a psychotherapy is. So you need to choose your doctor therapist according to your values also, which can be quite difficult because if you have an eating disorder, where are you going? Are you going to a psychiatrist, to a general practitioner, to a psychologist, to a psychotherapist, to a bodyworker, alternative therapist? Where are you going? And of course you're going where you believe is. You are going to the doctor or therapist you believe in. And this belief is very much created by culture, by society, by the public organs. So we have a big problem these days that the public authority is so influenced by industry that even the Ministry of Health are pushing drugs instead of informing objectively about the many different ways, and also paying doctors to give drugs and not to pay them to alternative and complementary holistic therapy. So of course this has a deep political side to it also, which you need to be aware of. So evidence-based medicine is much more than just evidence. Evidence-based medicine is a deep medicine where you're conscious about the context, about the values of society, the way therapists and doctors are trained, and in the end you need to understand what healing is. You need to understand what medicine is. Hippocrates says that what helps the patient is the patient, him or herself. What cures the patient is always inner healing forces in the patient. It's never a doctor, it's never a drug, it's never a cure. But what cures is life itself. And you need to be on life's side to be cured as a patient and to help the patient to be cured as a therapist or doctor. There's this meta dimension of evidence-based medicine, which is rarely addressed, which is the culture and philosophical and spiritual context of medicine. But I think we need to look into that also, to have a true evidence-based medicine.